there. My name is Caitlin. I'm one of the with the nurse practitioners. I'm going to be doing a physical exam on you today.
Okay.
You're Angela?
I am Angela.
Awesome. So Angela, can you tell me your birthday?
10/22/87.
Awesome. And then can you tell me what month it is?
January.
January. And what's the day?
25th. It's a Monday.
It's a Monday. And what's the weather like outside?
It's cold and there's snow on the ground.
Wonderful. So I'm going to tell you 3 words, and I'm going to come back in a few minutes and ask you what the 3 words were. Cat, dog, snow. Okay. And then, Angela, if a house were on fire, what would you do?
I would call 911 and get out of the house immediately.
Wonderful. So during the physical exam today, we're going to be doing a lot of different things. I'm going to be listening to your lungs and your heart. I'm going to be listening for bowel sounds and palpating different areas. Do you need to step out before we get started to use the restroom or anything?
I do not.
Okay, wonderful. So just before we get started, coming in to meet Angela, she's dressed for the, it is snowing outside, but she's in exam wear, which for purposes of this is appropriate. Her hair is not disheveled. Her face is symmetric. She's sitting in an upright posture. Before we started the video, I saw her walk in and sit down in the chair, so that's appropriate. She was also able to tell me her birthday, her name, what month it was appropriately, and what the weather was. She also has a really good sense of judgment because she was able to tell me what she would do if the house was burning down, and that was appropriate. Can you tell me those 3 words that I said before?
Cat, dog, and snow.
Cat, dog, and snow. So her immediate memory is intact, and that's good to know. So I'm going to go ahead and get started, okay? Since we already did vital signs before we started this video, okay? So just starting at her head. So Angela's head is symmetric. Both her ears are symmetric. It's rounded. There's no scars. I'm not feeling any bumps. It doesn't feel like she has any soft spots or anything like that. No fontanelles or anything I'm feeling. Your scalp is a couple tones lighter than your complexion, which that's normal. Your hair is not too oily and not too dry. You don't have any signs of alopecia. I don't see any lice or critters in there. No dandruff. That looks good. Any tenderness when I touch?
No.
All right. I'm going to go ahead and move to your face then, okay?
Okay.
So the next thing I'm going to do is an eye exam, which is important. So first I'm just going to look at the structure of your eye. So can you just close your eyes for me? Awesome. So I'm noticing that when Angela closes her eyes, it covers her sclera all the way. Can you open your eyes again for me? All right, her sclera is clear. I'm also noticing that you have some contacts. Have you been having any issues with your contacts?
No.
No, okay. Her eyes are symmetric when I'm looking at her. Her eyelashes are thick, and they appear to be in an upward position on her upper eyelid and a downward position on her lower eyelid, which is normal. I'm going to put some gloves on so I can look in your conjunctiva, okay?
Okay.
All right. So I'm just going to look at your conjunctiva really quick. Looks pink. All right. I'm just going to feel your lacrimal duct really quick. And I'm going to feel your lacrimal gland. Do you have any tenderness here?
No.
Wonderful. And there's no drainage coming out of this area, so that's nice. Your nasolacrimal gland appears intact and not clogged. All right. So now, before I shut the lights off, I'm going to test for accommodation really quick. So I want you to look at that duck back there. There's a stuffed animal back there on the wall.
Okay.
So I want you to look at that duck, and then look at this pin. And then look at the duck again, and then look at the pin. All right, wonderful. So Angela's eyes are accommodating as they should be. So when she looks at the duck on the wall, her pupils dilate, and when she looks at the pin, they were constricting appropriately. All right, so this is a Rosenbaum card. I'm going to have Angela hold it, and it will help me test her vision. So I want you to hold this 14 inches away from your face.
Okay.
And then I want you to cover your right eye. All right, can you tell me, can you read the lowest line on this side?
3, 7, 4, 2, 6, 8.
All right, and you can relax. Now, can you put this on your left side? Now, can you read the lowest line?
4, 2, 6, 7, 3, 9.
Very nice. Can you say that one more time?
4, 2, 6, 7, 3, 9.
Wonderful. Now, I'll take that back. I'm going to hand this back to you and let you do this with both eyes.
Okay.
All right, can you say your lowest line that you can read?
4, 2, 6, 7, 3, 9.
Wonderful. So Angela's vision on her right eye was 20/30, on her left eye was 20/20, and both together was 20/20. Is that appropriate with your contacts?
Mm-hmm.
All right. Right now, her pupils are equal. They're round. They're about a 5 right now. I'm going to go ahead and dim the lights, and then I'm going to test to see how brisk they are, okay? All right, so what I want you to do is look back over at that duck on the wall, okay? So I'm just testing to see how your pupils respond to light. All right, so your pupils go from about a 5 down to a 2, which is a good response. And when I turned the light on, they went from a 5 to a 6, which is normal because when it's darker, your pupils will dilate. And they're also consensual and reactive to direct and consensual light. So now I'm going to check for the red reflex. So I want you to focus on that duck on the wall back there, okay? And I'm going to use my right eye to look at your right eye, okay? All right, I can see the red reflex. Now I see the optic nerve. Now I'm going to check your left red reflex. Can you look over my left shoulder?
Mm-hmm.
My left shoulder?
Mm-hmm.
Sorry,
I had to write.
it's okay. Very nice. All right. Now what I'm going to do is I'm going to do the cover-uncover test, which I can turn the lights back on for this, okay? So the cover-uncover test is just going to check for the abducens muscle and just see how that responds. In a normal finding, your patient will look straight ahead and you will cover and uncover and you will not see any muscle movement at all. If you do see that, you might worry that some responses are not getting from the eye to the brain and to the brain back to the eye. So you just want to make sure that those muscles are independent of each other. So I want you to look back at the duck on the wall for me, okay? And just keep your gaze at the duck, okay? All right, you can relax. And Angela's abducens muscles were doing the right thing. They were not losing away from the gaze or going away from the gaze. So next, I'm going to listen, look in your ears and do a little assessment.
Okay.
I'm going to start with the whisper test, okay?
Okay.
So I want you to put your hands over both your ears. And now I want you to remove your right hand. And I'm going to whisper something, and I want you to tell me what I whisper to you, okay?
Okay. Duck, pig, night.
Yes. And now cover your other ear.
Cow, day, snow.
That is correct. Have you been having any tenderness in your ears?
I have not.
Any ringing in the ears?
No.
Any issue whatsoever?
No issues.
All right. I'm just going to go ahead and fill your tragus. Any tenderness?
No.
Any tenderness in your pinna?
No.
Just going to turn so you can see. Any tenderness on your mastoid?
No.
All right, let's fill the other side. Any tenderness on the tragus?
No.
Any tenderness on the pinna?
No.
Any tenderness on the mastoid?
No.
All right, so I'm just going to look in the ear with my otoscope. I'm going to lift the ear up and back and point my otoscope towards the near. As I'm looking in the eye, as I'm looking in the ear, the canal is clear. It's free of drainage. I don't see any cerebrum. I am seeing pink tissues in there, which is good. And I'm seeing a nice pearly gray tympanic membrane. All right, I'm going to do the same in this one, okay? Up and back is what I'm doing. Pointing my speculum towards your nose. You have a very nice clean ear canal.
Thank you.
I'm able to note that all the tissue is pink. It doesn't look inflamed. There's no exudate. Your tympanic membrane is nice and shiny and reflective, and it's pearly and gray. Okay. All right, now I'm going to examine your nose, and I'm just going to be looking to see if your turbinates are intact. I'm going to be looking to see if you have a deviated septum or if your septum is centered. I'm also going to be looking to see if I can see any visible drainage issues or any blockages, okay?
Okay.
Have you had any stuffy noses or anything?
No.
All right, I'm going to try not to shine this in your eye. I'm just going to take a look. Turbinates look intact, and they appear to be in their right location, and you do not appear to have a deviated septum. Don't appear to have any nasal blockages. Can you put your finger over your right ear and breathe in? Any issues? And put your finger over your left ear and breathe in. Any issues?
No.
No. All right. So now I'm going to move on to the mouth. Have you ever had any issues like dental procedures? False teeth?
I have a crown on this back side.
Has it been bothering you,
No.
or everything's intact? What about any decay in your teeth? Any broken, loose
Nothing
teeth?
current. I've had cavities before,
Okay.
but they've been filled and I've had no issues.
All right. Any surgeries with your ears, eyes, nose, or throat?
I've had my tonsils removed and my uvula removed.
Okay. So we will note that on our assessment that we will not be able to check for gag reflex, and we will not be able to see the size of the tonsils because they're not there. So I'm going to go ahead and look, okay? I'm going to use my light so I can see. All right, say ah. All right, so as Angela noted, I don't see any tonsils, I don't see any uvula. The hard palate and soft palate don't appear to be inflamed. Can you smile for me? Angela's teeth appear to be white. They don't appear to have any decay or tartar, which is good. Your dentist will be proud. I'm just going to go ahead and palpate your mouth, okay? So I'm just going to palpate your gum lines. You don't appear to have any receding gum lines. They're nice pink tissue. Any pain here?
No.
All right, I'm just going to palpate your hard and soft palate, okay? Any pain here?
Mm-mm.
No pain?
Mm-mm.
All right. Can you stick your tongue out? And do you lift your tongue? All right, everything seems to be intact. You do have a little white bump on your tongue. Did you burn your tongue?
I have geographic tongue, and sometimes I'll have abnormal patterns on my tongue.
Oh, okay. Have you been seeing a primary physician about that?
Yes, it's just an autoimmune disorder.
Okay. Well, we will note that on your exam. All right, so now I'm going to look at Angela's trachea, and I'm going to look for her thyroid. So first thing I'm going to do is just look and make sure the trachea is midline, and it does feel midline. I'm going to ask that you swallow for me. Very good. And I'm going to have you take a sip of this water and swallow one more time for me, okay? Wait for me to come back here. There you go. Take a swallow. Very nice. I'm unable to palpate your thyroid, which is good. That means that it's not enlarged. If it were enlarged, I might try to listen to it because sometimes you can hear bruise, but I don't need to do that because yours is not enlarged. Any pain when I palpate around here? Okay, so before I move on, I'm just going to go ahead and palpate your sinuses,
Okay.
and then I'm going to go ahead and palpate your lymph nodes.
Okay.
Okay. So I'm just going to lift up on your sinuses. Any pain?
No.
Any pain here?
No.
All right. So now I'm going to go ahead and start your lymph nodes, and I'll be feeling for any enlarged nodes or bumps, and I just want you to let me know if you feel tenderness at all. Okay? I might ask you periodically.
Okay.
Any pain in your preauricle?
No.
Postauricle?
No.
Preauricle?
No.
Postauricle?
No.
All right. Check your tonsillar nodes, your submandibular and submental nodes. Very good. Anterior superficial cervical nodes, superficial posterior cervical nodes, anterior superficial cervical, posterior superficial cervical, deep clavicular nodes, or deep cervical nodes, excuse me, and deep cervical nodes on this side. And I'm just palpating in a circular motion for any enlarged lymph nodes. Now I'm looking at your supraclavicular area. Any on this side?
Mm-hmm.
Let me go ahead and do infraclavicular as well, since I'm up here. All right. I'm going to go ahead and do your other lymph nodes as well. So I'm going to go ahead and look in your axilla for your central nodes, and they're underneath your axilla area, deep in the axilla. Any pain?
No.
All right. I'm going to go ahead and do pectoral one down here. And I would typically try to get underneath this bra. For this assessment, for the purposes of this course, we're keeping our patients fully clothed, so I will not be able to do that today, but I would in a normal assessment. I'm also feeling for the lateral nodes down the arm. Don't feel any enlarged nodes there. And then your subscapular nodes. All right. Around to this side. And I'm going to fill your axillary area for your central nodes, your pectoral area, and again I will try to get underneath this bra line, subscapular area, and your lateral nodes. And you look good. Very good. So Angela, we're going to go ahead really quick and do your upper extremities. So I'm just going to look at color.
Okay.
Her color is warm, or normal color. Her temperature is warm. Her hands are a little cooler. Her fingers are cold. Looking at her cap refill, she has good cap refill. She doesn't have any abnormalities. As far as that goes, she does have some clubbing on her fingernails. Do you have any history of medical history that would cause some clubbing?
I have Raynaud's.
Raynaud's, okay. So Raynaud's can cause clubbing of the fingernails. Have you seen any doctors for this?
Mm-hmm.
Okay, so that's an expected finding in this patient. Any clubbing can suggest lack of oxygen or lack of circulation in that area. So again, her hands are warm, or her arms are warm, hands are a little cooler, and fingers are cool to touch. She does have some clubbing on these fingers as well. I'm going to go ahead and feel your pulses, so your radial pulses on both sides. Awesome. I'm going to feel your radial and your brachial pulse at the same time. Very nice. So now I'm going to move on right to the anterior chest, okay? So just assessing Angela's chest. She has normal chest rise and fall. She doesn't appear to have any labored breathing, which is good. So for the purposes of this test, I'm going to do your cardiac sounds with your bra and your shirt on. So I'm not going to be able to necessarily see any lifts or heaves. And I probably will not be able to visually see the apical pulse rise. which sometimes with an enlarged heart you are able to see that at the PMI. So I won't be able to visualize that, but I can still feel for it. So first I'm going to just go ahead and listen to all of the areas on the chest. I'm going to listen with the diameter of my stethoscope. So I'm going to listen to the aortic valve, which is on the right sternal border, second intercostal space. The pulmonic valve, which is at the left sternal border, second intercostal space. The Erb's point, which is on the left sternal border, third intercostal space, and this is where you can hear S2 the loudest. I'm going to listen at the tricuspid valve, which is at the left sternal border, fourth intercostal space. And the mitral valve, which is at the fifth intercostal space, midclavicular line. And then I'm going to listen to your apical pulse for a full minute. All right, by my clock in my exam room, it's been a full minute. Angela's apical pulse was 68 beats a minute. So right now I'm going to go ahead and listen to your carotids, and then I'm going to listen to your lung sounds, okay? So I'm going to listen to the carotids with the bell of my stethoscope. So I'm going to lean it back a little bit. First thing I'm going to do is going to palpate the carotids. She has 2+. She has 2+ carotid on the right side. I'm just going to go ahead and listen for any bruits. Can you hold your breath for me? And relax. And hold your breath for me. And relax. There you go. So now I'm going to listen to your lung sounds in 8 different areas on the anterior chest. I want you to take some deep breaths in through your mouth while I'm doing this, okay?
Okay.
All right. Deep breath in. Very nice. So Angela has clear lung sounds. I can tell by looking at her, she has no barrel chest. She has equal rise and fall of her chest. It appears that she has a 2-to-1 ratio on her AP diameter, just by looking, which is a normal finding. I'm going to go ahead and have you turn around, okay?
Which way do you want me to turn?
Turn the chair for you. All right. So throughout this examination, there are portions of the examination that, due to having a fully clothed patient, I won't be able to fully assess things, such as her back. But just from what I see, she has no lesion. She doesn't have any scars from what I could tell. I would definitely want to assess for that in the lower back area. I'd want to assess for eczema or any other clues that could lead me to an assessment finding. If you have any moles on your back, I would ask how large they are, if they look normal or irregular. So now that I'm done assessing, I'm going to go ahead and just feel to see if she has symmetry. So I'm going to go down to your 10th rib line, and I'm going to fan my hands out and ask you to take a deep breath. All right. Less theatrical, regular breath, please. There you go. And she has symmetry on both sides, which is good. So now I'm just going to do a little bit of percussion. All right. So I'm just going to tap on your back, okay?
Okay.
All right. I'm going to take my gloves off since I don't need those. All right, so I'm percussing on her back. I just heard resonance throughout. If I had heard hyperresonance, that could indicate that she had some abnormalities like atelectasis or asthma, which doesn't have that. So resonance is good. She did have a little bit of dullness in the lower areas, but that's okay because I would expect that in the kidney region. While I'm done here, I'm just going to go ahead and assess for CVA tenderness. Okay. Let me know if this is tender.
No. No.
All right, wonderful. So now I'm just going to listen to your back, okay? So again, I want you to take deep breaths in through your mouth. And I'm going to listen in 10 spots down here, okay? With the diameter. All right, she had clear lung sounds, no advantageous sounds. Now I'm going to test for agophy, okay?
Okay.
So when I press on your back, I want you to say 99, okay?
99, 99, 99, 99, 99, 99.
Wonderful. So no abnormalities there. All right, so now you can go ahead and turn back around. So just to recap, cardiothoracic, Angela did not have any murmurs, no skips, no irregularities when I was listening to her heart rate. Her heart rate was regular, 68 beats per minute. Her lung sounds were clear. She didn't have any carotid bruits. Her posterior lung sounds were clear. She had resonance throughout, which is a normal finding. She had no CVA tenderness. So now I'm just going to lay back a little bit to assess for your abdomen. And I'm also going to go ahead and try to feel your apical pulse and feel for a PMI.
Okay.
And as I said before, we may or may not have a accurate assessment of those just because you're clothed today, okay? So normally,
Oh boy.
too much.
Oh boy.
Too much.
Oh boy.
We're just trying to figure out these off-the chairs. So typically, we would have our patient's knees bent a little bit, and she would be lying flat. But we are working in an ophthalmology clinic today, so we are doing with what we have. So first, my hands are a little cold. I'm just going to feel for your, are you okay?
Mm-hmm.
I'm going to feel for your apical pulse here. And I'm not able to palpate it. Sometimes in very thin people, you can palpate it, and then other times you can palpate it if they have, it's an indication of how large their heart is. So it's not bad that I can't palpate it. Sometimes you just can and can't. Her PMI, you can't feel that. It's about 2 centimeters.
Mm-hmm.
I can't actually palpate your apical pulse now. I think it was just your bra was in the way. All right, so now we're going to move on to the abdomen. So I'm going to assess first if I see any pulsatility from her carotids, her aorta, excuse me. I'm also going to look for pulsatile movement from the renal arteries, which would be very unlikely, and also from the femoral arteries. Because she's fully clothed, I'm unable to see any pulsatility through her clothes. I'm also going to look to see if I see any bulges. Right now she has a flat stomach. I cannot palpate, I can't visually see any bulges. I don't see any ascites, but again, it's really difficult to assess that because she's clothed today. So now I'm just going to go ahead and listen to bowel sounds, okay? I'm going to listen with the diameter of my stethoscope. Starting at the right lower quadrant. And I hear a positive bowel sound. If I didn't hear something, I would listen for 2 to 5 minutes before saying that it's hypoactive or not there. Moving to the right upper quadrant, I hear a positive bowel sound. Left upper quadrant, positive vowel sounds. Left lower quadrant, positive vowel sounds. So I'm going to flip my stethoscope to the bell. I'm going to listen for aortic bruit. I can hear your pulse, but I don't hear a bruit. We'll listen over the renal arteries. I also feel your pulse down here, or hear your pulse, excuse me. I don't hear a venous hum, but that would not be a abnormal finding if I did. I don't hear any bruits. I'm going to listen down here at the femoral arteries. I don't hear any bruits down here. While I'm down here, I'm just going to palpate for your femoral pulse, okay? 2+. I'm going to check your other side. Okay, 2+. So now I'm just going to do a little bit of percussing, okay?
Okay.
All right, so I just heard some tympani and a little dullness in the left lower quadrant. And now I'm just going to do some light palpating, okay? Just on your quadrants of your belly. Do you feel any tenderness?
No.
No touching? I don't feel any distension anywhere. That's what I'm feeling for here. Doesn't feel like she has any blockages in these areas. No gas, from what it seems like. I'm going to palpate a little deeper, okay? Tell me if you feel any tenderness at all.
No.
All right, I don't feel any big prominences or masses in her stomach. That's good. Now I'm just going to check McBurney's point to see if you have rebound pain, okay? Rebound tenderness. So I'm going to press down and just let me know what you feel when I release.
It does not hurt.
Okay. So that's a sign if somebody has pancreatitis, they might have rebound tenderness at McBurney's point. And if I let go, they would be out of this chair. That's how bad the pain is. Now I'm going to go ahead and feel for the sternal border or the border of your liver, okay?
Okay.
So I'll just take a deep breath in and deep breath out and deep breath in. All right, I can feel the border of your liver. All right, and relax. Now I'm just going to feel for your kidneys. Deep breath in. Deep breath out. It's okay, I didn't know if you were grabbing for me.
I didn't mean to hit you.
All right. Let's go for the other one. Deep breath in. Deep breath out. All right, very good. At this point, I would actually want to look for a hernia also.
Okay.
Which I would actually look a couple inches above the umbilicus. Probably about 6 or 7 inches, maybe 3 below the sternum. But I would want to just basically inspect the stomach and have my client put her chin to her chest and look for any bulges in this area. And I don't see that, so you're okay. Typically you'd want to do this again with the shirt off, but we're not going to do that today. So now I'm going to sit you back up, okay?
Okay.
We can get our chair to cooperate with us. All right. I'm just going to assess your lower extremities. There's no swelling in her knee joints. Can you turn this way a little bit? There we go. No swelling in the knee joints. A little bit of varicose veins. Any pain?
No.
All right. No swelling in her calves. No swelling in her ankles. Her legs are warm. Once I get down to her feet, her feet are cold, but you don't have any socks on and it's cold outside. It's pretty cold in this room also. And you have Raynaud's, which that's not going to do anything good for your extremities anyway. She has good calf refill in her toes. All right, so I'm just going to test for a pedal pulse. I'm testing a right pedal pulse right now. I'm going to test her right pedal pulse and her post tibials at the same time. they're 2+. Now I'm going to test her left pedal pulse and her left post-tibial at the same time. All right. So now at this point of the exam, we're not going to be doing it, but we're going to talk about the breast exam and also testicular exams. So for Angela, I would just want to assess for symmetry of the breast. I would also want to assess the nipple line. I would then want to ask about breast exams. Do you do them?
Yes.
Okay. So the women should do them once a month in the shower, or you can do them after your period. You can do them lying down. I would have my patient, if we were doing it today, lie on your back with a pillow underneath. I would raise the arm of the breast that I was examining. There are a couple different techniques you can use, but I would just want to palpate all quadrants of the breast, and including the talus fence and the nipple line. And I would do the same on the other side. And then I would want to do teaching where I would have like a demo to have my patient show me how they do the breast exams. And then if there's any lumps or bumps, think back to what you've had to eat or drink. Sometimes the things like coffee and dark chocolate can cause lumps. But if you have any lumps that you're concerned about, you need to follow up with your OB or your primary care physician. For the male exam, as far as monthly exams, same thing, once a month in the shower is okay. If I'm going to do an assessment on a male, I would want to inspect the penis and the scrotum for hair distribution. I would want to look for any signs of STDs. I would want to look for tenderness, any masses. I'd want to look for any drainage. Excuse me. I'd want to palpate the testes, the epididymis, the vas deferens for size, for tenderness, for masses. And then I would educate them that while doing their monthly exams in the shower, they would want to maybe use a mirror, and I would use a demo method to make sure they knew how to do it correctly. Do you have any questions about this? Okay. So in addition to doing my physical exam, I'd also want to make sure that before I did any physical exam that I had a clean exam room, free of clutter from previous patients. I'd want to make sure that I had only the amount of tools that I needed, just because I don't want there to be any extra clutter in the room. This exam room is very clean. I also want to make sure I provided my patient, male or female, with dignity by providing lots of privacy while not examining certain areas. And I also want to make them feel as comfortable as possible. And that is it. Thank you.